You've seen our research on social media. Now, join us as we dive deeper into the public health topics of our time, featuring new studies and findings generated by our faculty and researchers committed to advancing health equity. From the Department of Population and Public Health Sciences at Keck School of Medicine of USC, this is Preventive Pros, the podcast.
My name is Rita Burke. I'm an associate professor of clinical population and public health sciences, and I have a joint appointment in the Department of Pediatrics. I really didn't know a lot about emergency management before I started my internship at the Los Angeles Department of Public Health. I was there during the anthrax attack, and that letter really changed the trajectory of my career. We're certainly seeing an increase in the number of disasters with the advent of climate change, and we've had the recent storms and flooding all across Los Angeles County and really the entire state. We're seeing more and more how important it is for us to think about disasters and to think about preparedness, what we can do as individuals and as communities to withstand the impact of disasters. They're only going to be increasing with time, and we need to be better prepared. No one really likes to think about disasters, and what oftentimes happens is we are reactive. Something happens, and then we will take action. What we are trying to do is to be more proactive. So instead of taking action after something happens, really thinking about it and how we can better prepare now when things are calm, so that when something does happen, and we know it's a matter of time, we're going to be able to withstand it and be resilient. A lot of times thinking about disasters can be really overwhelming for people, and so they decide they're not going to do anything. But I want to really encourage people to start small, pick something that is really manageable for them. Maybe it's getting a 3-day supply of water. Maybe it's buying some extra canned food. Make sure you have the can opener handy as well. Maybe it's putting together a small disaster kit in their car or at work. Start with really something that's manageable so you don't get overwhelmed. You are going to set yourself up for success. Even just doing that small piece is going to have a huge impact. Emergency management is an actual career. I've had a lot of students take my PM 567 class, not realizing that this is something that they can actually go into. And as the course progresses, they realize that this is really interesting and can have a huge impact on the world. Every organization, every private, governmental organization will have some sort of version of emergency management. And it is an exciting career, and it's also one that makes an impact. So I encourage folks, if they're interested, to look more into it, and they're always welcome to come talk to me.
Preventive Pros, the podcast, is produced by the Department of Population and Public Health Sciences at Keck School of Medicine of USC. To learn more about any of our episodes, or to subscribe to our monthly Preventive Dose newsletter featuring the latest in public health research and news, visit pphs.usc.edu/podcast. Thank you for listening.